After Harriet Ware's death, the Board of Managers continued her groundbreaking work. The managers are deeply sensible of the responsibility devolving upon them in the discharge of their important trust. Upon the kind sympathies and liberal aid of a generous public, they rely for the requisite means, with divine assistance, to make this institution a rich blessing to the community. In the mid-1800s, the Board of the Society also became leaders in championing other children's rights issues, such as the need for child labor reform. Throughout this period, the Society constantly grappled with its biggest challenge, the need to promote its mission in order to raise funds. If the community generally were more particularly acquainted with this charity, they certainly would be willing and glad to provide means by which many more of the unhappy, homeless children of our city might be brought under the fostering care of this institution. In the early 1860s, the Providence Children's Friends Society was able to break ground on a new, larger home on Toby Street, thanks to a generous donation from the Ives family. A larger home was needed to accommodate a growing number of children at the home, some orphaned because of the Civil War. Can we hope then that the plaintive voice of suffering childhood will rise above the storm of war and make its piteous plea heard and the strife of arms? War, the gigantic producer to evils, is adding its terrible power to the increase of juvenile pauperism. Each severe campaign, each battlefield, prepares orphans for our home. During the Civil War, the Rhode Island General Assembly thanked the Providence Children's Friends Society for its innovative work with a special resolution.
Resolved that the humane and Christian work of gathering within its home and training for usefulness in life neglected and forsaken children meets our warmest approbation, and the entire arrangement of the institution render it a model worthy of imitation. Providence, 1882. Population 116,000. 100,000 more than when Children's Friends Society was formed nearly 50 years earlier. Prior to this time, if someone witnessed severe parental child abuse, there was no legal action that could be taken, because Rhode Island had no laws protecting children from parental abuse. But thanks to the efforts of women in the community, like those who worked for Children's Friend, the state finally passed a law against child abuse in 1882. To police that law, a charitable organization was formed, the Rhode Island Society for the Prevention of Cruelty to Children. It was founded 12 years after the Rhode Island Society for the Prevention of Cruelty to Animals.
The Rhode Island Society for the Prevention of Cruelty to Children was founded by men. They were all male agents, and they were very much a quasi-police force in that they had enormous powers for a private agency. They could go into any home, they could remove any child. It was them who would prosecute parents and send them to jail. It would be them who would collect fines and penalties for parents who abused their children.
RISPCC operated an emergency shelter for abused children on Doyle Avenue. Children were kept at the Doyle Avenue shelter on only a short-term basis until a more permanent solution for each child could be found. Sometimes children were returned to their parents. In other cases, RISPCC tried to place children in foster homes. Children's Friend and RISPCC, which later changed its name to Rhode Island Child Service, competed for funds and resources.
Many people believe that the years between 1880 and 1920 were sort of the high ground for children's reform because so much happened. More legislation related to education, more legislation related to children and public health, more legislation related to child protection. In the 1920s and the 1930s, the country was faced with some pretty significant economic pressures. People were falling on hard times who had never expected to do so. Accordingly, the pressures felt by the Society for the Prevention of Cruelty to Children and Children's Friends were absolutely immense. Donations to the agencies were falling while demand was increasing. And at this time as well, we moved to this idea that if we could provide support for families, that would be a better alternative than removing poor children from their families and having them grow up in an institution. So we do see in the 1920s and the 1930s, as difficult as those times were, a real focus on, let's see if through income support to mothers and families, in fact, we can reduce the number of children coming into care, because so many of the children who are coming into care were not because of abuse or neglect, it was because of poverty.
At one time, while I was there were 75 children there. They tried to make it as good as they could, really. Of course, I didn't always think so at the time. They tried to have balanced meals for us, and we always had milk and vegetables. Mrs. Sawyer was the superintendent of the home. Mrs. Thousand was matron. She was in charge of the girls. Mrs. Gleason was in charge of the boys. The nurse at the home was Mrs. Small. She was a very nice person, very nice.
The Children's Friends Society led the move away from institutionalization of poor children by closing its Toby Street home in 1926 and advocating for foster care and family support as better alternatives. A few years later, Children's Friend hired its first professional social worker.
In the 1920s and the 1930s, you begin to see everything about social work professionalizing during this period, being handed over from volunteers to professions who would dedicate themselves to a more scientific approach.
With a dramatic increase in need brought on by the Great Depression and a dwindling availability of charitable donations, both Children's Friend and RIS-PCC were constantly seeking new ways to raise funds to support their efforts. They both became early members of the Providence Community Fund, a precursor to United Way, an organization founded to coordinate and consolidate charitable donations.
We have to remember that an organization like Children's Friend never got a penny of state funding well into the 30s. In Rhode Island, it was private contributions, private donors that really carried the water for child welfare well into the 1950s.
Children's Friend and Rhode Island Society for the Prevention of Cruelty to Children, which later changed its name to Rhode Island Child Service, found themselves in constant competition for funds and resources.
Between 1920 and 1950, there were 4 different plans to merge those two organizations, and they simply weren't ready to get married. In 1949, there was a report and a lot of pressure from the Child Welfare League of America, from United Way, and from other funding organizations, which basically said these two agencies really do need to merge. There's too much overlap and there's so much unmet need that if these agencies merge, they could probably not only save money but improve their services. So 2 very mature executive directors were resigned, and that sort of created an opportunity for this merger. But still, within the first 10 years, it was difficult. They had a board that was close to 100 people, 50 people from each of the partners, very unwieldy.